We didn't get a negative, did we, Art? I didn't hear one, and the consensus around this table seems to be that for the good health of the community, that CFS patients should not be donating blood irrespective of whether XMRV
Chris, let me add very quickly,
the
XMRV is just the latest virus, or latest infectious agent. EBV has been around for a lot longer than that, and some of us who see adults who develop primary EBV disease, not very commonly, but who develop primary EBV disease get very, very ill. And the idea that you would assume worst case scenario, which is what this policy would clearly do, because we're assuming that the majority of chronic fatigue syndrome patients have some sort of an infectious agent that can be transmitted through the blood. We have absolutely no evidence to support that statement yet. Absolutely agree with that. But if we assume that and the harm that we're potentially doing is minor, the scare is already out there. I promise you, in the patients, in the community, in the support groups, it's already out there. And with Canada being the latest to add on to deferral, I think it's a legitimate question to ask the question, why is the United States lagging behind if the policy, and I heard that it wasn't going to be that onerous to make at least that recommendation out to the American Red Cross and to the local blood banks.
That was the sense I got.
And that's as far as we can go, and that's as far as we should go, I guess.
So I made a friendly amendment to Lenny's recommendation that we recommend to the Secretary that he ask the blood supply to defer anybody with a history of CFS from giving blood, and a question be added to.
I accept that friendly amendment. I call the question.
The question's been called. All those in favor?
Aye.
Opposed? Abstentions? Motion carried. Thank you. So, 11:30. We're still doing okay for time.
Any look back at recommendations that the committee feels is essential, because then we can just start into the charter discussion.
Wanda?
Sure.
You know, one thing that you mentioned early on was that there was some discussion about a state of the science meeting, and I know you also said that we haven't heard from some of the ex officio members, and certainly Eleanor Hanna has talked to us about some of the issues about that. I think if we had a better sense of where that is going, because I know that she has at times also mentioned that there could be people on this committee that might kind of even be, sure.
And it's state of the knowledge. I would correct that. Sure. It's a different process.
It's going to be a state of the knowledge meeting, and I have mentioned it here before, and we haven't begun the formal planning yet. I wanted to get it on the agenda today so you'd be aware that we would probably be contacting you, and I mean, we could discuss it a bit in the research subcommittee if you wish, but it's going to be a standard state of the knowledge format, not a state of the science, because there isn't enough science yet. And I will be asking members of this committee to participate both in the planning and presentations at the meeting.
As part of that, though, I would reflect back on the recommendations that ARC was expected to develop a review, complete a review of CFS for the State of the Knowledge workshop. Is that, in fact, still a part of the process?
Well,
and that
we spoke about it, and I mean, outside of the XMRV, I don't know if we're going to get anything very different from this. I mean, we're going to have to determine if we've come up with anything different from this.
For the record, and because it's not being projected, probably not being picked up very well by the cameras, Chris Williams from ARC has provided us copies of the evidence report technology assessment number 42, defining and managing chronic fatigue syndrome, that was published by ARC 10 years ago, basically. Correct, Chris? 2001. There are copies in the back of the room that you may take with you if you're in the audience, you didn't get them, but we have not distributed this to members in the past, although it's available online. It's in the archive part of the website, and we had hard copies that ARC generously provided. Good.
Chris and I have been talking about this, so we're going to be, this may indeed be part of the State of the Knowledge meeting, but we have to make a decision.
Okay.
Jason?
Mike, I'm going to As in advance, but I asked you at the meeting in October about the International CFS workshop that was going to be winter 2009, and you said it had been pushed back. What are the plans for that?
You asking me? That would be a program issue. Dr. Unger may be able to address that. I haven't heard on that yet. We've been reorganized since then, so that's where the energy has gone.
Do you want to?
The question was the thoughts and plans for an international workshop.